Hello, everybody, and welcome to today's seminar. You're all very welcome. I know we have doctors who are tuned in from all over the world, so welcome all. Quick rundown or quick introduction on FRS Recruitment. We have been in operation since 1980. We're Irish-based. Initially, we were recruiting in the agricultural sector, but we've gone into many other sectors, including commercial, IT, engineering, to name a few. And we have a very strong healthcare team. And within that healthcare team, we have different divisions. So we have a nursing division, we have an allied health division, and we have a doctor's division. So most people, I'm assuming, that are tuned in today are here for the doctor's seminar. So on the call today, we have myself, Dave Maher. I've worked with FRS since 2017, and I have 12 years experience in the healthcare industry. We have Sheena Morgan, who joined us a couple of years ago. She is South African. She came over to Ireland in 2013. And she's been in recruitment since then. And we Cheryl Briffa, who is from Malta. Hi. And Cheryl is our compliance team lead. She's worked with FRS for 2 years, and she's about 7 years experience in immigration and compliance sector, so big experience. We've two people in the back room. We've Emma and Etna, Emma Fenton and Etna Vaughan Witz, who have extensive experience in recruitment, and they'll be answering specific questions offline as well. Okay, so we will get the ball rolling. So COVID-19 is obviously very topical at the moment. We're in unprecedented waters. I suppose, Sheena, you might just tell us how COVID-19 has affected the July rotation specifically.
Yeah, I already see some questions coming in about the COVID and, not finding jobs. Do you have to be in Ireland? Look, it's been anything but a normal rotation. It has affected, I think, worldwide. So what happened is a lot of Irish doctors came home as before shutdown. We had doctors that had retired volunteering to assist and to help out. And also for the first time ever, the doctors that have just recently qualified from the colleges were all offered an internship. Now, that would be both Irish and foreign doctors, and that has never happened before. And they've also already are in the hospitals where normally they only start in August. So positions were being filled by the internship doctors. Hospitals were also concerned, are we going to get doctors into the country from outside? Having said that, there are doctors that are coming from outside. Whether they'll arrive on time or not is another issue. Of course, anybody coming in would also have to do their 2 weeks quarantine before starting within the hospitals. So it's been different. Having said that, there are still positions. We are still looking for anesthesia, emergency medicine, pediatric. I think for you, Dave, oncology doctors.
Yeah, definitely oncology, yeah.
And if not starting in July, between July and January, we see there will be a few gaps. And then, of course, there's another big rotation in January. So if not now, we're certainly going to be able to assist you in the coming months.
Definitely, and I think that's great advice as well. Yeah, just send in your CV anyway, and look, if we don't get you something in July, we'd be in a position to get you something in January, assuming that January will be busier, which we think it will be. Just in terms of the COVID-19 situation, I think the government have gone from a 5-phase approach to a 4-phase. And I think that's down to the good work that's done here and the progression we've made. So phase 2 we're in at the moment. We're into phase 3 on, I think, the 28th of June. And then the final phase, which is phase 4, I think is July 20th. So it's moving in the right direction. But it's been tricky, obviously. Sheena, you moved here, I said in the intro, you moved to Ireland in 2013. You're from South Africa originally. How has the move been?
It was an easy move. Look, I was coming to somewhere I didn't really know too much. I think I had been to Ireland sort of 20 years prior to that. And I think I was surprised at how multicultural Ireland is and how welcoming the Irish people are. I got into recruitment of doctors by default and really enjoyed it. And so we speak to people from all around the world. We bring doctors in from all around the world. So it's a country you'd be coming to that's safe. It has a very good schooling, though my children were finished their education, and also a good tertiary education system. Another plus is schooling is free and of a very high standard.
And that's a big plus as well, isn't it? Because we get a lot of doctors from overseas that would say, look, the education system in their own country is quite expensive. and they're pleasantly surprised when they come to Ireland that the education in the vast majority of the cases is free. There is private education, of course, but the majority of people tend to go down the public route, which is good. Again, in terms of proximity, I mean, we talked about this earlier, Sheena, just in terms of how close we are to Europe and the kind of benefits that offers.
Yeah, you within 2 hours of most European countries, across to the UK is much quicker. There's flights, there's ferries, so it's a good stepping stone into Europe. Again, it's an English-speaking country, so you don't have to necessarily be able to speak German or French, and you don't need to speak Irish. So when you first arrive, you might think that the Irish are speaking a foreign language. It takes a while to get
tune in your ear a bit, I think.
You have to tune in your ear. Now I don't even notice the Irish accent. So, but look, it's an easy enough transition. It's a beautiful country. Everybody always thinks Dublin. It's not necessarily wanting to come to live in Dublin. It's more expensive. Rentals here would be probably twice as much as going sort of more to the west coast or going down south towards Cork. But nothing is too far. Everything's within maximum, I'd say, 3.5-hour drive from Dublin. Most places within 2.5 hours.
And the roads have improved significantly. If we're going to go back to kind of 15, 20 years ago, even longer, I suppose, before we were kind of properly in the EU, the road quality was always something Irish people gave out about. But through probably a lot of EU funding, the roads have come on in leaps and bounds. And it's very accessible. It's such a small country that you can get from A to B in a short period of time.
And just going back on the HSE, the public health system, there's hospitals throughout the country, and they are teaching hospitals, they are university hospitals, they're not confined to Dublin alone. So don't feel you're going to be going to a hospital that's smaller, doesn't have the same status in a more rural area. That's certainly not the case here in Ireland. Would you agree, Dave?
I would fully, absolutely, yeah. And I think the majority of the doctors that we deal with start off initially in regional hospitals, and they may move into more urban areas and after a while. But I think it gives you a good grounding from like a work perspective and otherwise. I think you get probably a more rounded approach. You're not as pigeonholed as you would be in larger hospitals. So there's benefits to both, definitely. In terms of financially, you're much better off as well. Your euro will go a lot further in a regional area, which will make a difference because Dublin is, very, very expensive in terms of accommodation. One of the big bugbears, I think, for recruiters, Sheena, in the medical world is the language competency tests. So do you want to maybe just go into detail on what's required?
Look, we get questions daily, and I'm sure there's a few coming in on the side there regarding the OET or the IELTS. Now, I do understand for your Irish Medical Council registration, you might not need this, especially if you're having a postgraduate degree, or you have a membership, your MRCS or MRCP or your MRCOG. You might not have to do it, but to work within an Irish hospital, it is mandatory. There was a directive, I think, came in 2018 from the Irish hospitals.
Yeah.
And so go ahead and book it and do it. It's a lot of doctors find the OET, because it's medically orientated, is a little bit easier. You require a B in each category to pass the OET. On the IELTS, you need an overall score of 7 with nothing less than 6.5 in each category. Now, there are people that we can pass you on to that will help you to pass the OET. They of course, would be a charge for that. But, prepare for it. Try and set the exam. I know at the moment with COVID, again, things are on hold. But try and get that done. It's valid for 2 years. So within the 2 years, we will hopefully get you here to Ireland, and then you never really have to do it again. But It's just to make sure that it's mandatory. So I know you've written the membership exam and it's been in English, but unless you have graduated in an English-speaking country, and that consists of UK, the US, Canada, Australia, or New Zealand. Coming from South Africa, I would have thought I'm English-speaking. I wouldn't need to do the test, but because there are 9 languages there, yes, you do have to. So just go ahead and do it. you'll get through it. You'll be surprised.
You'd be surprised. And it can be confusing, I mean, for doctors who have applied to the IMC and get IMC registration, then they're a little bit taken aback to say, look, well, I've applied to the IMC, I've got my number, how do I still need to do the language competency? And I suppose the short answer is that the hospital have a different set of criteria, and all hospitals require IELTS and OET. There really are no exceptions unless you apply to the IMC before 2014. So the advice is to do it. Many doctors say to me, look, I'm very, very busy. I'm doing exams. I don't have time to do it. And look, we fully appreciate that. There's a huge amount of workload and exam study that needs to be done. But I will put this at the top of my priority list if I'm going to, doctor looking to come to Ireland. Sorry, Sheena, yeah?
Yeah, if they are seeing your CV and they see that you have an OET or IELTS, you immediately at an advantage. Or if you have booked it, we let the hospital know that yes, you have an IELTS or an OET booked. So just go ahead and do it. Make things a lot simpler.
Yeah, I think that's a great point, Shane. Actually, yeah, it's like if you haven't done it, at least if you show intention and book it and forward us on the booking confirmation, we can then forward that onto the hospital and say, look, Dr. A doesn't have the IELTS or OET, but they have booked in the exam, and that will definitely help your case. Just in terms of the application process, I know the guys offline there, Emma and Etna, apologies, are doing some sterling work. They're answering questions. And I know Dr. Coomer, the anaesthetics doctor, had a question that's Emma's after answering back. But a lot of questions are IMC related, and what's the process. So Sheena, do you want to just talk us through what's involved?
Yeah, the first thing is to go onto the Irish Medical Council website. It's quite an easy website to work through. Also, there's Epic. We can send you all these links afterwards. We can put them up on our website for you. Now, the advantage of Epic is that they will verify all your documents for you. So it's maybe speeds up the process because the IMC then don't have to do that verification. It's being organized as a doctor. Cheryl, I'm sure you'll agree here. If you have all your paperwork in order, it will speed up. Look, if you graduate outside of Europe, sometimes there's a little bit more you need. It might take slightly longer. I've had doctors coming in from outside of Europe that have been so organized, and within 12 weeks they've had their registration. Unfortunately, we can't guarantee a time. Going back 2 years ago, we could sort of push the IMC for you. We're no longer allowed to do that because of GDPR. So it has to be your decision, you getting organized. Again, there it's your good standing certificate. If you have all your documentation together, apply, follow the step by step. If you're struggling, please, we will help you with the process. Either one of us as consultants or Cheryl will actually help you and guide you with the process.
Great. And just in terms of that, we give great support, and not alone from a work point of view and advice from a compliance point of view. And we have Cheryl, who's our compliance team leader. And as I said, Cheryl's worked with the company for 2 years. So Cheryl, I suppose a handy way might be to start by giving the doctors or people listening just kind of an overview of what you do.
Yeah, so basically once the doctor gets the offer, I will get hold of that doctor and make sure that I hold his hand throughout the whole process. So if he needs any documentation filled to complete any forms, needs a work permit or a visa, I will make sure that gets done and processed and issued in time for the doctor to start his employment on time.
Okay, great. And that's a huge support, I'd imagine, for any doctor who may be overwhelmed by the process, because there is a lot of paperwork to gather. Before, let's say, Cheryl, that I'm a doctor, I have made the IMC application, I have submitted my application either, to a recruitment agency like FRS. Is there anything that doctor could do to kind of speed up the process? Could they gather any information or documents before they get an offer?
Yeah, so I would always suggest first and foremost to get references. We would need to have to contact your referees directly ourselves, but I would suggest the doctor to get 3 referees' contact details ready to go. So I would suggest the doctor to speak to the referees and let them know that they're going to be contacted shortly by us. So that would speed up the process for ourselves, because without references, you would not be able to start your employment. They are very important. Second, I would say the service letter. So you would need a service letter from each employment you have worked with in the past and from the current. And you would need these in order to be put on the correct salary scale. So let's say you worked 2 years in 2 different hospitals, you would need a service letter from each hospital, and it would need to be on a hospital headed paper listing your role, your name, and your employment period. These are very important. Like we always insist that you get these from your hospital, from your previous employers, from your current employer, because you would be put on the correct salary scale, because if not, you will be on 0.1, let's say, which is the lowest scale for a really long time until you actually produce those letters and then be put on the correct salary scale.
Yeah, that's a good point, I think, because that happened a few times with me, with doctors I was dealing with recently, that they may have worked in 8 or 9 different hospitals. You know, they may have done locuming over the years, and they may have got, of the 9 hospitals they worked in, they may have got 6 service letters back, meaning they missed out on 3. So they then won't get put on the correct salary, isn't it, if they don't have the full amount of
Exactly,
unless you get those letters, you will be put on an incorrect salary, and it makes a big difference. If you move to Ireland, you want all the the disposable income you possibly can, and if you're going to get less than you should, it can be a drawback. So strong advice would be to get all your service letters in advance of even getting an offer, so you're prepared. And I think as a general theme is just about around preparation, really, isn't it? There tends to be a strong link between doctors who are well organized and the process moving smoother, as opposed to maybe doctors who aren't as organized. So
it will make a big difference, like when I send that initial email with the list of documents, a doctor that's already organized and knows what needs to be done beforehand, he will just send me the documents and we can start the process ASAP, basically, especially if the doctor needs a work permit. We would want to submit that application as soon as possible, because it takes time until it's issued. Well, currently they're being processed faster, the work permits, because they're essential workers, but still it needs to be submitted as soon as possible, the application. So if we get the documents faster, then the application will be submitted faster.
Yeah. I think it's just little things like checking the date on your passport. How long is it valid for?
Yeah.
We've had doctors that their passport is only valid for another 9 months. That's no good to apply for a work
Has to be, it has to
be a year.
Yeah, exactly. It has to be valid for at least 1 year if the doctor would need a work permit. Yeah.
And Cheryl, the police clearances, do you want to
I would say you would need a police clearance from any country that you have resided in for more than 6 months. So I would suggest as well to look into the procedure of how to get this police clearance. Some might you be able to get them online, others you have to go to the office. So I would suggest to look into these steps. So once you get this offer and I tell you need a police clearance, you can just go ahead and do the steps required to obtain that police clearance.
Great, perfect, fine. I see the questions are coming in thick and fast, and there's one very grateful doctor by the looks of things. I see a love heart in the mix, so the work getting us doing there is obviously very much appreciated. Yeah, like, I mean, as I said, like the more organized you can be, the better. Big question I suppose doctors would have, Cheryl, is work permits and visas. So can you just tell us what the turnaround time at the moment is?
Yeah, so as I was saying before, we're a bit lucky with the work permits at the moment, if you could say that word. They are being processed faster. They're being put on top of the list for essential workers. So healthcare professionals are essential workers. They are required to come to Ireland as soon as possible to join their employment in the Irish hospitals. So basically, we have seen work permits that are being issued within a week, so which is very, very good, because normally they take around 4 to 6 weeks. So with regards to work permits and employment permits, we are seeing that turnaround very fast. But with regards to visa now, it's a different story. You would need some country. It's according to the country at the moment, right? We're going country by country. So let's say one country might be still in lockdown, another country might just coming out of lockdown, and one country might be fully open and they're going ahead as normal. So it's a country by country basis at the moment. Some embassies are still closed as well, so it might be more difficult for the doctor to obtain the visa. But some countries are doing the online visa, or you can send your documents by post. So it is just as I'm saying, it's a country by country basis. Some visas are taking a bit longer than usual, so it could take around 3 to 4 weeks, sometimes, and sometimes less. So again, it's the country by country basis.
Yeah, but I mean, again, the big advantage is the fact that they will have you as a support, because again, it can be quite time consuming.
Yeah,
it's fairly a bit. Parts can be cumbersome, and it's great to have support at the end of the phone, or via.
Yeah, we will push from our side. Like, I'll try my best to push and expedite the applications, both for the work permit and visa, as much as I can. And if there's an issue, or if there's a problem, or if there's a document missing, I'll try my best for you, like, to submit these documents as soon as possible, so we get the ball rolling and get them issued as fast as we can.
I think just as a team, as the doctors team here in FRS, we certainly assist you in so many other ways. You send your CV to us, we'll pick up the phone, we're going to tell you if your CV is good enough, what you need to add, or the order it should be in. We the very best to get you that opportunity of getting at least an interview. We prepare you really well for your interviews. We have excellent relationships with all the hospitals here in Ireland, both the public and private sector. So we know the medical manpower managers well enough that we can pick up the phone and say, hey, I've got this great doctor. And we do everything we can to assist you. Sometimes the process takes a little bit longer than normal. We've got no guarantee of when positions will become available. But generally, January and July, there's a turnaround of doctors. Contracts are either 6 months or 1 year, and they are either renewable, or we find you, once you're here in Ireland, a job in another hospital. So don't be scared to ask what you may think are silly questions. We never think of anything as being a silly question. We will guide you. We will hold your hand. We'll be honest. And I think that's where we make the difference. We work as a team, and we all have our own verticals. So we specialize in specific specialities. Dave does the sort of general medicine and all subspecialities. Etna is on the emergency medicine. Emma does anesthesia, pediatrics, and psychiatry. I myself do obs and gynae, surgery, and orthopedics. And then we all work with regards to placing consultants across all specialities in Ireland.
I think that's
so
a
we
big,
have a lot, yeah.
big plus as well, Sheila. The fact that we're all in different verticals, we've expertise in our kind of in our own areas. One question that kind of keeps cropping up in these is, doctors who have applied continuously for the last maybe couple of years or couple of months and can't get work, and the feedback is that they don't have enough Irish experience, they don't have UK experience, and they seem to be getting a little bit frustrated. So, and they're asking, look, what can we do? And it is very, very tricky. Sometimes if you don't have Irish experience, it might be more difficult to get a job. And how can you get Irish experience if it's hard to get Irish experience? So what I would recommend, and I don't know about you, Sheena, my recommendation has been to upskill as best you can. So maybe start with the academics. So medicine, for example, I would always recommend doctors to become a member of the Royal College of Physicians, so the MRCP, and do your 3-step exam process there. Again, it may take time, but it's definitely worth it when you're fully MRCP qualified. Do anything you can. Maybe clinical attachments might be an option for people to come to Ireland, and gain as much relevant experience as you possibly can. Would you have anything else you'd like to add there, Sheena, for doctors who may be...
No, I think look into doing the membership exams with the Royal College of Surgeons. That's certainly, if I look at obs and gynae and surgery, it's almost a necessity now that you have your MRCSI or your MRCOG. Also, if you have, I know a lot of the South African doctors have your diploma in anesthesia or your diploma in emergency medicine. That certainly is better, or if you have a master's postgraduate qualification in anything, that certainly helps. Look, there's a little bit of a luck element we don't know. This rotation, there could be a real need for ED doctors. Next rotation, it might be for pediatric doctors. But sometimes it's that 6-month wait, and sometimes you don't get a job for July, but by September, there's something for you. So we try our very best. We don't, we send on your CVs, we chat to the clients, we do our best to try and get you an interview. And yes, I suppose UK Irish experience is always preferable, but I have had doctors that have been offered the position over doctors that have got Irish experience. So it's not impossible. We will guide you, we will direct you, and we'll do our very best to find you a post.
Definitely, yeah. And I suppose the main things to have in place anyway would be, your standard things like you're fully IMC registered, you've a valid IELTS or OET, and then any additional things like she was saying, work experience or academic piece that you can add to your CV will go a long way. Just being persistent. I mean, keep trying. I had a doctor the other day that texted me. I think he may have been looking for about 18 months, and he eventually got a job in South Tipperary. So he was absolutely delighted with that. So, I mean, it paid off all the perseverance in the end. So let's go back a second here. So Sheena, just in terms of career paths, we touched on the salary that doctors potentially could get. Another question that crops up continuously is career progression. And any kind of words of wisdom for anyone listening in?
Look, there are training schemes here in Ireland. We do have doctors that come in and start as registrars because they have experience from wherever, if it be Malaysia, Sudan, Saudi. Look, we have doctors from all around the world coming in. But you can get onto training schemes. If I, being honest, go back 6 years, yes, there were very few foreign doctors getting on these training schemes. That certainly is not the case now. So you have your BST that get you to registrar level, and then you get your higher specialist training. Now they're competitive. They are extremely competitive. But if this is what you want to progress your career, the advice I give you is start speaking to the consultants you're working with. Ask them for guidance, what you need to do. You're in the environment. They know. They will assist you. They like to help you to progress your career as best you can. And look, Ireland is also a stepping stone. You've got experience within a Western English-speaking university. We do have some doctors that go on to the UK from Ireland. But we are certainly seeing foreign doctors getting onto training schemes. So it's not going to happen overnight. You need to get some Irish experience, probably 2-3 years before looking into these schemes. But your consultants and your the medical manpower team will certainly assist you and guide you.
Yeah, and I think kind of 4 years tends to be the kind of magic number too. That if you're here 4 years, you're eligible to become an Irish citizen or get Irish nationality.
5 years. 5 years.
5 years, apologies, yeah.
5 years.
And then you are, effectively then you're a European citizen, which means that you are as likely to get a job as an Irish person. So maybe stay here for 5 years, get your citizenship, and then apply
for the schemes.
Schemes.
Royal College of Surgeons website is very informative. If you're wanting to look at career progression, what you need to do, I suggest you go onto the Royal College of Surgeons Ireland, and they give you the training schemes per speciality.
Yeah,
and the requirements.
Yeah, and other websites as well. Obviously, the IMC would be beneficial as well to pop on to. Yeah, look, I mean, I'm trying to look at the questions coming in. I know Emma and Ethna there are fielding a lot of them. Another question from a Dr. Agaja. Again, I hope I'm pronouncing that name correctly. Dr. Agaja is a surgeon. He said he's 56 years of age. He's 25 years experience. And he's saying, how can he apply? So look, from the question, I'm guessing that he's saying, look, maybe is 56 too late? But it's not. I mean, we've had a lot of our registrars in particular who would come in their earlier mid-50s, and that's doable, Sheena, right? Yeah.
It is doable. You've got great experience. Look, surgery is one of those where they look for experience. So the more experience you have, the more likely you are to find a surgical post here in Ireland. So certainly apply. I think the retirement age is 65 for doctors.
65, I think, yeah.
So you can certainly, you'd benefit coming, and you could impart knowledge onto the young doctors here. It's very much, I think the Irish system is very much working as a team. And that team is from the nurses to the junior SHO doctors to the registrars to the consultants. So look, if the hospitals are well equipped, you know, it's a great country to come to. And I think any career, it's important to get maybe experience elsewhere. It can only, if it's short term or long term.
Yeah, enhance your career, enhance your CV. We have
Yeah.
a couple of consultants on the call as well, Sheena, and I know some consultants may have specialist registration, and they've asked how doable it is or how viable it is to expect a consultant post when they come to Ireland. And look, it does vary from specialty to specialty. My advice often is to get your experience as a registrar, even if you've worked as a consultant for a number of years in your own country. Familiarize yourself with the Irish system for a couple of years, and then work your way up to be a consultant. I suppose there may be an expectation from some consultants that they can just come over here and get a consultant post. Unfortunately, generally not the case, right?
It is hard having no Irish experience. And of course, you do have to be on that specialist registrar with the IMC. Without that, you cannot work as a consultant here in Ireland. So even if you have your specialist registration, come in, work as a registrar. Some doctors progress really quickly to that consultant level. Others take a little bit longer, but it's certainly possible. But be prepared to maybe step down one notch, and long term, it's possible.
Yeah, I think it's kind of the old cliche of short term, or the old adage of short term pain, long term gain. Look, it mightn't be everyone's cup of tea. If they've worked as a consultant for 15, 20 years, they may not think they may be suitable to work as a registrar, but maybe do it for a couple of years, see how you get on. And you'll then have the Irish experience coupled with your strong consultant experience in your own country, and you'll be in a very strong place then to get a post.
But again, send us your CV.
Yeah.
We'll go through it with you. We will speak to the managers, the medical manpower managers within the hospital. Send on your CV. Ask them what's the likelihood. They will speak with the consultants, and you might just be lucky and find a consultant role. So it's not impossible. But
exactly, yeah. Just on that there, Sheena, I just see an email in there from Emma. She's typing back and forth with a Dr. Becky, and I think Becky was just asking what's the best way to kind of reach out to us. And Emma's mentioned a doctor's email, so I think it's doctors@frsrecruitment.com. And also people can go on our website, so there's a list of our current vacancies, and you can apply through our website as well.
That's the best. Send us your CV. One of us will be in touch with you, and we will try and answer all your questions, and we try our very best to find you something suitable here in Ireland. It might not be for this July. It might be between July and January, and it could be for the January rotation, or even July next year. But the first thing is get your IMC, get your OET or your IELTS, send us your CV, and we'll guide you from there every step of the way.
Exactly, and it's just about being patient too, I think, Sheen, isn't it? I mean, it's not going to happen overnight, and it may be the next rotation you have to wait for. But, as Sheena said, we'll try our best to get you a job. And then as Cheryl outlined earlier, we'll do our very best then in terms of assisting you with compliance and
I think
arriving there, yeah.
And I think I think we'll all agree, once we've placed the doctor, they keep coming back to us when they're wanting to move. We have a lot of referrals for friends and colleagues. So I feel we're doing something right. We're offering a bit more. Looking at you as an individual, not just clumping you together with a lot of other CVs that come in. So send us your CV. We'll be in touch, and we look forward to assisting you in finding a suitable role here.
Great stuff. Okay, well, look, we're going to wrap it up. So, folks, I hope you found that helpful and useful. Appreciate everybody's time, and we will see you again. Okay, all the best.
Thanks for joining us. Take care. Bye-bye.
Bye-bye.
Bye. Thank you.
Bye.
Bye.